extended fast in emergency department. So a general rule when you are reading the chest X-ray, bone will appear white or black in chest X-ray. White. What about the air? Excellent. And in between, it will be appear a gray. طيب. So when you interpret the chest X-ray, make sure it's for correct patient, correct date and time, correct examination. And you should identify the right and left side based on the gastric bubble, and always compare it with the previous film. And make sure, is it inspiratory or expiratory film? Is it anterior posterior or posterior anterior film? Or is it lateral or lateral decubitus film? There is many approach how to read the chest X-ray by using the ABCDE approach. So you should check the airway first by tracing the trachea to the carina, and then trace the main bronchi down to the periphery. Then you should assess the breathing by assessing the lung, comparing right and left, upper zone, mid zone, lower zone. And then you will assess the circulation by assessing the cardiac position, cardiac size. Then you move to the D, you check for any bone pathology like fractures or metastasis to the bone. Then you will do the E, which is everything else. You will assess for free gas under diaphragm, any subcutaneous emphysema or gastric bubble in the correct place. This is how to read the chest X-ray and how you can identify the landmark of chest X-ray. This is again how to read the X-ray, and this is highlighting the ribs, the cardiac border, clavicles, carina. So this is just to give you a hint how to read the chest X-ray. Can someone tell me what you think about this chest X-ray? So what I need from you from ER in the ER course is just to give me the spot diagnosis. Can someone interpret this chest X-ray? Is it normal or abnormal? And if it's abnormal, what is the abnormal pathology? Shraika? Any taker? Is it normal or abnormal X-ray?
Normal.
Excellent. This is a normal chest X-ray. So what I need from you, just mention it's normal chest X-ray. What about this chest X-ray? Is it normal or abnormal?
Abnormal.
Okay, excellent. What is the abnormality?
Right
Spot
middle lobe
diagnosis?
opacity.
Excellent. So right middle lobe opacity or consolidations, based on the history, most likely this is the right upper lobe or right upper lobe pneumonia. What about this X-ray?
Right middle lobe consolidation.
Excellent. So right middle lobe consolidation. So you should get history physically to give a diagnosis, but most likely this patient has a right middle lobe consolidation corresponding to pneumonia. What about this X-ray?
left lobe
Okay.
left lung pneumonia.
Excellent. So you should identify the location. So this is the left upper loop homogeneous opacity or consolidations. You should take history and examination. Most likely correspond to left upper loop pneumonia. And I'm presenting both the BA film plus the lateral film. What about this X-ray? What's the abnormality? ايش رايكم يا شباب؟
Right upper loop consolidation.
Excellent. So right upper loop consolidations or right upper loop homogeneous opacity based on history and examination, most likely this patient has right upper loop pneumonia. What about this X-ray?
Pulmonary edema.
Excellent. So you can see the cardiac size is enlarged. If you're gonna do the cardiothoracic ratio, as well as you can see the vascular marking or enlargement of vascular margins, which is correlate with congestion, and we call it Kerley B lines. So correlate pulmonary edema. What about this chest X-ray? Again, pulmonary edema. So you can see large vascular marking and Kerley B lines, and enlarged cardiac size or cardiac border. What about the machine? What do you think? ايش الجهاز هذا؟
Pacemaker.
Excellent. This is pacemaker. Okay. What about this chest X-ray? This is a little bit complex chest X-ray, but you can see increased vascular marking with picture of pulmonary edema, and there is reticulonodular opacities in both lungs, maybe present pulmonary edema plus minus pneumonia, mainly in the right side of the lung. What about the chest X-ray? Is it normal X-ray?
Pneumothorax.
Where?
Right lung.
Okay, you should mention there is a right pneumothorax or right large pneumothorax with ipsilateral lung collapse with deviation of mediastinum and trachea to the opposite side. If I told you that the patient is hypotension, this is what we call it. If patient present with this pneumothorax and hypotension.
Tension.
Excellent. Tension pneumothorax. So what's your treatment or what your immediate intervention?
Tube.
Excellent. Where?
Interface space for safe line.
Excellent. So either needle decompression or chest tube in the fifth intercostal space, anterior to mid-axillary line in the same site of pneumothorax. What about this X-ray? Is it normal or abnormal chest X-ray? يلا يا شباب.
pneumothorax في الرايت لاين في الرايت لاين بي or left lung now.
right?
Left lung
And
with shifting of mediastinum and trachea to the left side, to the
excellent.
right side.
And excellent to the opposite side with أيوة
Ipsilateral collapse.
ipsilateral. Excellent. هنا again you can see clearly the pneumothorax in the left lung or left pneumothorax with ipsilateral lung collapse and shifting the mediastinum to the opposite side. طيب ايش رايكم بالاكس راي هذه؟
Pleural effusion.
Excellent. Where?
Right lung.
Right lung pleural effusion. طيب كيف نعرف انه pleural effusion it's not atelectasis؟ عادة في sign احنا نسميه هنا ايش؟
Meniscus sign.
Excellent. meniscus sign شكله هلالي كأنه هلال. طيب what about the chest X-ray؟ So there is obliteration of the left costophrenic angle. So is it effusion or collapse? ايش رايكم يا شباب؟ This is a left pleural effusion. You can see clearly the meniscus sign. The degree of effusion, this is maybe moderate or mild effusion. What about this X-ray? ايش رايكم؟ Is it normal, abnormal? ايش رايكم يا شباب؟
نفس الإجابة شوي. Pleural effusion
So
في الرايت lung.
where? Okay, is it
Right lung.
moderate, severe, large, small, moderate?
ما أحسه سفير مرة.
Okay, so it's a large
Yes,
right-sided pleural effusion causing deviation of the trachea to the opposite side. Your treatment?
Intubation.
ايش رايكم؟ Intubation?
Chest tube.
أيوة, chest tube. You should do thoracentesis. You should remove the pleural fluid before attempting intubation. Because intubation, it will not fix the underlying pleural effusion. So you should drain the etiology, the cause of respiratory distress. This is again left-sided small pleural effusion. Again here, right-sided pleural effusion. So what do you think here? What's abnormality?
Atelectasis في left lung, shifting the
Okay.
trachea to the same side.
Excellent. So this is a complete total lung collapse on the left side with deviation of the trachea to the same side. If it's effusion, the trachea should be shifted to the
Opposite side.
opposite side. So what about this chest X-ray? Again, this is complete or total collapse of the right lung with the trachea deviated to the same side of lung collapse. Again, here is tenting of the left hemidiaphragm indicating lung collapse or atelectasis of the left lung. شايفين الارو على التنتنج of the diaphragm. What about this chest X-ray? What's abnormality?
Air fluid level.
ممتاز. وين؟ ممتاز. The right middle, right upper lung, there is a air fluid level which is indicate of ايش الباثولوجي غالبا؟ ايوه بس ايش هذه؟ It's a cavitary lesion or lung abscess. طيب هنا ممكن تشوفون هنا right or left lung air fluid level, and you can see by the CT you can see the cavitary lesions inside the consolidated lung. And again, air fluid level, if you do the CT you will see the cavitary lesions. So this is indicate either TB or lung abscesses, mainly Staph aureus. What do you think about this X-ray? Trauma patient.
flail chest.
أيوة flail chest. How we define flail chest?
Paradoxic breathing أو movement.
ممتاز. بس by X-ray how we identify or how we define a flail chest?
تستعمل 3 رب.
Okay, it should be 2 consecutive reps. It should be, it has a fracture on both sides. هنا عنده multiple rep fractures, so more than 2 reps with يعني each rep it has fractures on both sides. يعني يكون عندك 3 fragments. This is a normal chest X-ray. What do you think about this chest X-ray? Is it normal, abnormal? So the patient should go where?
laparotomy.
أيوة laparotomy. CT if he's stable, otherwise you should go for laparotomy, exploratory laparotomy. Again here, this is air under diaphragm. Okay, indicate perforated fiscus. طيب هنا ايش تشوفوا هنا الاكس راي؟ ايش اللاين اللي في الستومك هذا؟ ايش رايكم؟ ايش ايوه نيزو جاستريك تيوب. اكسلنت. طبعا راح ينتهي الوقت، راح ارسل لكم لينك جديد اذا طفى معانا الزوم. طيب what do you think about this line who's coming from the esophagus or coming from up and going to the right leg? ايش رايكم؟ This is a wrong placement of the nasogastric tube. So it's instead of going through the esophagus, it's going through trachea to the main bronchus, to the left, to the right main bronchus, to the lung. طيب هنا الاكس راي ايش شايفين؟ ايش اللاين اللي في trachea or the tube in the trachea؟
AT tube.
AT tube. ممتاز. طيب what about اللاين اللي جاي من right neck going to the heart؟ ماشي مع الجاجلر vein. واضح لكم؟ أيوة central line. So this is a excellent. This is central line. This is a right internal jugular venous catheter coming from the jugular vein toward the superior vena cava to the right atrium. What about this chest X-ray? شايفين many lines. Patient عنده endotracheal tube bilateral chest tubes and 2 chest tube in the right and 2 chest tube in the left. It's a busy chest X-ray. Any questions about how to interpret, how to identify pathology by interpreting chest X-ray?
لا واضح.
ممتاز. So I will end the lecture. I will send you a new link, then we'll